Hello, today is Sunday, September the 16th. It's been a few days since I had my lap band procedure done. My procedure was done by Dr. Gaza Yearly. He is from the Detroit, Michigan area, and it was performed at the Crittenton Hospital there. Everything went really smoothly. Got there at 5:45. Got in, got paperwork done, all the normal stuff. The surgery lasted about 45 minutes. I did have to stay overnight. I was pretty out of it from the medications and stuff. And I don't know if it's normal that they use staples. I've read that sometimes people just end up with steri strips or glue, but I have quite a few staples in me. So the procedure went really, really good, and I felt a lot better. Some of the nurses there that were actually the OR nurses had it performed by Dr. Gaza Yearly themselves, and that made me feel a lot better getting to see them and talk to them. I wasn't really that nervous. I just remember laying there thinking like, oh, I'm really getting this done. I'm getting ready to get the lap band done. And after it was all finished, I just remember thinking, like, there's nothing between me and skinny now. I can get there. I can get healthy. I can finally be where I want to be. And that was kind of an overwhelming thought because I've never really had that thought before. So surgery went really good. As far as pain and things afterwards, what you read about or hear about as far as gas pains definitely is the case. I had a lot of what felt like chest pains and pressure and stabbing, and I thought maybe I was having a heart attack. That part was pretty rough. I got prescribed several different painkillers and Gas X strips. They're like you stick them on your tongue, and those I've been consuming those like crazy. A lot of rolling around on the floor, up, down, squats, anything I could do to try to relieve that pressure. It was really, really painful. Today is the first day that I'm up and I'm out and I'm about, and it's 3 days afterwards. So, um, day one and day two, I was kind of wondering what I was doing to myself, what I had done. Today, I feel pretty good. I have some pain still when I take a really deep breath under my left rib area, which I'm assuming is where something is pressing against it. It actually kind of reminds me of when I was pregnant. Being pregnant full term, and you have babies' feet underneath those ribs, and you can feel that pressure, and that's what it feels like to me. So if you're a guy, I guess that won't make any sense, but if you've been pregnant, then maybe you'll know what that means. So 5 incisions total, little tiny one up, down, and over, and then two um, larger ones, maybe about that size, where I guess the port and something else. I don't know. I don't know. I just know that there's staples there and big bandages over it. So I go get those out Friday. So far, I have lost a total of 15 pounds. So that's 5 pounds since surgery. I'm still pretty bloated. I can kind of feel a little bit of a difference. I think once all the swelling and bloating goes down, I'll feel a lot better. Um, and obviously, all liquid diet. I'm still on all liquids. And today is the first day that I've really attempted to eat anything. I had some broth earlier and a couple of spoonfuls of really, really runny oatmeal. And maybe a quarter of a cup of a protein shake. And I noticed that just that small amounts is enough to satisfy me. So hopefully these next 4 weeks will kind of I'll breeze through them and not feel like I'm starving the whole entire time, which was what I was worried about. Um, and then once I move along to eating, then I think we'll be good to go. So, a few days after, definitely so far, I would say is worth it. It's exciting to know that I have all the tools and everything that I need to finally lose weight and be healthy. So, I guess next time I see you will be in a couple of weeks, and hopefully, maybe you'll be able to see it in my fat face by then that I've lost a few pounds. So, Thank you guys. Bye.